I know time is really precious. So, and we're all, we're really, really grateful that everyone could join today. Okay, so welcome to our Lake County MHSA public hearing for fiscal year 24-25 annual update. We're excited to have everyone in the room and those that can join us today. But of course, we're recording, and this recording will be posted on the Lake County MHSA webpage after this meeting for anyone who couldn't attend. All right, so we're going to start with a welcome and introduction. So I think as we get started, if you're attending in person, please take a moment to fill out the sign-in sheet that all of your facilitators have with them. And if you're online with us on Zoom, please use the Zoom chat to introduce yourselves with your name, your pronouns, and your program or your affiliation with LCBHS. But with that, I'm also going to pass it over to Stacy, who will be welcoming us to this meeting. She is the chair of the Behavioral Health Services Board. So Stacy, I'm passing it over to you.
Hello, good morning, everyone. My name is Stacy Bethel, and I'm the chairperson of the Behavioral Health Advisory Board. And welcome to this meeting.
Thank you. Scott, do you have any words for a welcome?
Yes, just what this is our public hearing for our MHSA update. As the public hearing, by law, our Mental Health Advisory Board, which Stacy is the chair, is actually technically hosting this hearing. That's why we've asked her to kind of kick us off. And I think I'll turn it back over to you, Paulina, just to kind of explain what this is.
Absolutely. Yeah. Thank you for kind of grounding us. I think just to build on what Scott was saying, a lot of you have been with us in this journey of creating this annual update for fiscal year 24-25. So if you remember, I think it was in February and in March, we met for community meetings. In the first meeting, well, actually, I have a graphic for this. So I'm gonna review what we went over in those community meetings, but hopefully that jogs folks' memory of what we've done so far. And we're here today to talk about the annual update and get comments from stakeholders on the update so that we can move forward with submitting it. All right, so here we go. Our agenda. So, everything is coming out one by one. All right, so first we're going to kick it off with an MHSA training and education piece where I'm going to go over MHSA in general, kind of lay the groundwork of what MHSA is, give a background, and then I'm going to go into more detail on the annual update and the community planning process that you all have been involved with over the past few months. And then we're going to move into talking about Prop 1, which was just on the ballot in March. It's MHSA modernization. MHSA becoming the Behavioral Health Services Act. So we're going to talk about that a little bit and open up the room for any questions that folks may have around that. And then we're going to review our community needs assessment findings. So we did a really deep review at our last community meeting, talking about what we found through our community needs assessment and our community survey that we distributed earlier this year. And then we're going to move into proposed MHSA program modifications for fiscal year 24-25, as well as a program budget request as well for fiscal year 24-25. And then at the end, we're going to have public comment where folks can come off mute or add into the chat any comments that they have in response to the annual update. And here are our objectives. So we're going to present the proposed MHSA annual update developed with community input. So what we've been working on for the past few months. And then we're going to provide opportunity for everyone to provide public comment if you so wish. All right, a little bit of housekeeping. So for those attending in person, there will be a coordinator at each site to help manage the Zoom meeting and facilitate attendee participation. If you're joining virtually, Please feel free, if you are able, to find a quiet, distraction-free location with strong internet connection. But of course, if you have any technical difficulties, feel free to add it in the chat or ask for any support that's needed. Please save any substantive comments, questions, or feedback for the end when we do our public comment period. And then if you're attending in person, please feel free to raise your hand, and a coordinator will let us know if there's a question in the room, and we will allow you to ask your question, your comments. So even if you are in person, you are extremely welcome to add any comments or questions to the call as needed. So please don't be shy. We're all here and want to hear from you. So yeah. All right, so just kind of want to go over some logistics on how you can contribute to the discussion. So if you are using your computer and you're on Zoom, you can click on the participants icon at the bottom of the screen and select your raise hand icon, and that will raise a virtual hand for all of us to see that you have a question. If you're on the phone or if you're calling into Zoom, you can use the raise hand function by pressing *9. You can also share all of your comments and questions using the Zoom chat feature. There is a chat icon at the bottom of the screen, and you can type your comment into the chat box. And then, of course, during the meeting or after the meeting, if you have additional comments, please send them over to Scott Abbott, and there is his email at the bottom. All right. So I think before I head into the Mental Health Services Act training and education, I did want to ask, I know we aren't able to do formal introductions just for the sake of time, but I would love to acknowledge any of the folks or that are in the room from the peer support centers. So feel free to come off mute. Do we have any peer support centers in the room today?
We do.
I see a few. Also, feel free to use the chat if you would like as well.
Here, I'm here, Melanie Lynn. We're here at Circle of Native Minds. Good morning.
Good morning. Amazing. We have representation from the Circle of Native Minds. Thank you for being here. We're honored to share a space with you. Are there any other peer support centers that are here?
I see Lavos online.
Lavos, welcome.
Edgar.
Hello, hello.
I'm
All
not
right.
sure if the camera works. The Harbor's also here.
Harbor.
Oh, great, Harbor.
Great.
Welcome.
Welcome, welcome. That's awesome. So we have Circle of Native Minds, Lavos, Harbor. Thank you all for being here. Thank you to everyone. Really excited to have you all with us. All right, so I'm going to move on into the Mental Health Services Act training and education piece. This is essentially, we do this at every one of our meetings because it is a requirement, but I think it's also great to ground us in what MHSA is. Before we start talking about Prop 1 and those changes, and before we go into the annual update. So MHSA was passed on November 2004, also known as Proposition 63, and it was intended to expand, transform the mental health system. And this is actually unique to California and very exciting legislation. And there are 5 core values or guiding principles related to MHSA. So we have proactive, it's wellness, recovery, and resilience, cultural competence, integrated service experience, community collaboration, and client and family-driven services. And more of the nuts and bolts of what MHSA is, it's a 1% tax on income for those over $1 million as well. So that's a little bit of a brief overview of what MHSA is and the legislation. There are 5 components of MHSA. So we have community services and supports, which has 8 different categories, and half of CSS funding does go to full service partnership programs. And CSS includes outreach and direct services for serious emotional disturbances or serious mental illness for people of all ages. We also have prevention and early intervention, or PEI. And this is focused on stigma and discrimination reduction, outreach to increasing signs of mental illness. And it's essentially the goal is to prevent the development of mental health problems and screen for and intervene with early signs. And half of PEI funding actually goes into children and youth services. Next, we have innovation, which is 5% of the total budget. And this is essentially money or funding that goes towards testing new approaches that may improve mental health outcomes. It's one-time funding, and it's meant to support learning, research, and piloting innovative programs and service aspects, which is really exciting. And then lastly, we have Workforce Education and Training, or WET. And CFTN, which is Capital Facilities and Technology Needs. So WET, those funds are to build, retain, and train public mental health workforce. And CFTN is funding for infrastructure support, such as electronic health records, facilities, etc.
The reason those two are in gray is because they're actually, they're not required, but counties have the ability to transfer 20% of CSS into one or both of those categories, which we take advantage of.
Mm-hmm. Thank you, Scott. Awesome. All right, so here is a table for all of the MHSA programs that are currently or in fiscal year 23-24 a part of Lake County and how they fall in those 5 different categories. And so on the left-hand side, we have community supports, services and supports, or CSS. And under that, we have programs including Crisis Access Continuum, Forensic Mental Health Partnership, like I said earlier, full service partnerships, Native American peer counseling, etc. And then if you move into the middle column, we have PEI. So these are our prevention and early intervention programs, which include early intervention services, family stabilization and well-being, older adult outreach and prevention. Interestingly, so the peer support recovery centers actually receive both CSS and PEI funding, and that also goes for the outreach and engagement programs as well. And then for innovation, we have the Multi-County Full Service Partnership Innovation Collaborative. And then also here, Scott was saying too that CFTN and WET are not required, but they are being done in Lake County, which is really exciting. And that includes Capital Facilities, the Electronic Health Record Project, and WET initiatives to bolster and strengthen the mental health workforce. All right, so that kind of concludes our education portion. But of course, if you want to learn more about MHSA programs, please visit LCBHS is such a tongue twister, MHSA website that's on the screen. And I'll also throw it into the chat once I'm when I move over to the chat. But that is what we have on the education piece. I did want to open it up. Does anyone have any questions on what I just went over about MHSA? Before we move into talking about the annual update. All right. And if anything comes up, please don't please feel free to come off mute, raise your hand, or add something to the chat. But now we're going to talk a little bit more specifically about the annual update and community planning process. So the purpose of the annual update. So it provides updates to the adopted MHSA 3-year plan and 3-year program and expenditure plan for fiscal year 2023 to 2026, which is what we worked on last year to create. And so based on that plan, we are doing annual updates yearly to essentially provide updates on where we are and the progress and where programs are at and if there's any modifications that are happening. And so it's a way to also bring together the community and keep them abreast on the changes that are happening within mental health and the programs in Lake County. So the annual update outlines program status and service accomplishments in fiscal year 2022 to 23, and program changes beginning in fiscal year 24-25. So it's based on the needs assessment and stakeholder input. So we talk about the status and accomplishments, and then also any changes that may be happening in the next fiscal year based on the needs assessment that we have been doing over the past few months. And then the community planning process. So that's what you all have been joining us for. The MHSA intends that there be a meaningful stakeholder process to provide subject matter expertise to the development of plans focused on utilizing the MHSA funds. And so as stakeholders, you all are the experts. And we want to bring you in so that we can, as we're forming these plans and changes and where we want to allocate budgets, it's so important to have community input. And so the fact that you're here and that you've been with us is absolutely amazing and valuable. So thank you. So PEI evaluation reporting, this is a little bit separate, but it's still a part of the annual update. So in fiscal year 18-19, the MHSOAC, which is the kind of oversight governing body related to the MHSA, they updated PEI reporting requirements to include evaluation of PEI programs or the prevention or early intervention programs. And those requirements include an annual report specific to PEI programs. So that will include consumers served, the consumer demographic information, program accomplishments, etc., as well as specific program implementation and outcome information based upon the PEI service area. And then there's also a PEI 3-year evaluation report. And this reports on program status, the consumers served, and program accomplishments during the previous 3 fiscal years. And similarly, it also includes specific program implementation and outcome information. So the 24-25 annual update that we're presenting to you all today will actually include the PEI annual report as well. Lake County has been working with all programs to strengthen data collection and outcome reporting, and PEI programs to strengthen PEI specific reporting. So that has been a big undertaking and really exciting to strengthen reporting and data collection. All right, here's a slide just kind of calling out the stakeholders that we have invited into the room throughout this process. So the stakeholders include everyone, including adults and seniors, families of children, adults, or older adults with severe mental illness, providers of mental health services, law enforcement agencies, education agencies, social services agencies, veterans and representatives from veterans organizations, providers of alcohol and drug services, healthcare organizations, and other stakeholders. This is not an exhaustive list, but we want to make sure that we're including all of these groups as we're developing the annual update and now reviewing the annual update and trying to gather public comments so that we can truly make this a document built on community voice. All right, roles and responsibilities. So here are the main folks that are also kind of guiding this forward. So we have community stakeholders, all of you, and then we have LCBHS, so developing the annual update. So they are really guiding this process and making sure that this annual update is reflective of community needs, priorities, and identified strategies. We also have the Mental Health Advisory Board to assure that stakeholder input, review, and that stakeholder involvement is truly happening, and that they will review and advise on the annual update as well. And then, as we are doing right now, hosting or conducting the public hearing. Board of Supervisors will then review and approve the annual update. And then there's us. We are RDA Consulting. I guess I did not do an introduction, but we are RDA Consulting, and we've been working with Lake County Behavioral Health Services in developing and creating their annual update and helping with the community planning process. And here's a little snapshot of our timeline. So this all started back in December 2023. So this past December, We kicked off this project. We looked over documents and got ready any new changes in requirements for MHSA. We reviewed past documents and past 3-year plans and annual updates. And then we went into phase 2, where we had a needs assessment, which all of you participated in. We had 2 community meetings. We had one community meeting aimed at talking about what are those needs, what are the priorities for this next fiscal year. And then at the last community meeting in March, we reviewed all of those results with you all and got feedback on which should be priority and what should be the focus. And we also had a community survey go out as well, I believe in January or February. And we received a lot of responses, and we included that in our needs assessment as well. And then in phase 3, we entered some program planning. So we synthesized all of that stakeholder input on needs, and then we reported back. And then we developed the plan. And so that's what we're here for today. We developed the annual update, and we posted it for public comment about a month ago, or exactly 30 days ago. And we've been collecting comments, and now this is the culmination. We are at the public hearing. And then after the public hearing, we will finalize the annual update and present it to the Board of Supervisors. Okay. I think we are complete with the MHSA portion, and I'm going to hand it over to my colleague, Jamie, and she'll be going over Prop 1.
Thanks, Paulina. And you can go to the next slide, please. Okay, so Proposition 1, so Paulina just explained MHSA as it was passed in 2004. And this past year, there's an initiative proposed by Governor Newsom called Proposition 1, or kind of known as MHSA modernization. And this is really an initiative to modify the behavioral health system and expand MHSA with an emphasis on kind of expanding housing and treatment options. This initiative was put to the vote, and it was passed by Californians on March 5th. And then next slide, please. So MHSA has 2 major components. The first is more of funding infrastructure, and the second part is actual updates to the Mental Health Services Act. So on the first part, many of you know across California, there's been a shortage of housing and treatment options. So, which can mean that the shortage means that people can wait a longer time for care, or might not receive the right care at the right type of place. So to help address this shortage, the MHSA modernization includes about $6.5 billion in funding to build or develop behavioral health housing and treatment. So about $4.5 billion would be earmarked for more mental health treatment options, including mental health care as well as drug and alcohol treatment. About $1.5 billion of this would be put into a specific funding that government agencies or local entities can apply for. The second kind of component of this would be $2 billion that is being earmarked for housing options, so permanent supportive housing, of which there's $1 billion that is earmarked specifically for veterans. And the housing component will be giving money to local governments as grants or loans to turn hotels, motels, other buildings into housing, or even used to kind of construct new housing. The second part is what's amending the Mental Health Services Act. So first, it's expanding to include substance use treatment in mental health services. So because of that, it's also changing the name from the Mental Health Services Act to the Behavioral Health Services Act, because now it will also include the option for funding substance use treatment. It also revises the distribution of MHSA funding, which we'll show you in a minute. But again, to really kind of prioritize funding for housing. There are some things that it requires the counties to bill Medi-Cal for reimbursable services. So because the funding allocations are changing a little bit, really leveraging different types of funding, such as Medi-Cal, to be able to pay for services. And I think, Scott, you've mentioned that this is something that Lake County already does, really maximizes Medi-Cal reimbursements. And then it also establishes some different oversight and accountability measures that'll be coming out over the next several months of exactly what those different types of things would look like. And then on the next slide, so this is a slide kind of showing the current allocation that Paulina went over, and then also the proposed allocation and how it's going to change. So the top is the current allocation. So the Proposition 1 or MHSA modernization, it doesn't actually change the tax itself. So it's still a 1% tax on millionaires. So it'll be the same amount of funding, but the way that it's going to be allocated is going to change a little bit. So with the current MHSA, the state gets 5% of the funding. With MHSA modernization, that's going to increase to 10%. That's going to be going to the state and state-led programming. 4% is going to be going to kind of state-led prevention programming. 3% is going to be going to state-led workforce investments. And then 3% is also going to be going to statewide oversight and monitoring. So of the 90% now that's going to be going to counties, so as Paulina kind of talked about initially, or as it stands right now, about 3/4 of the funding is going to community services and supports, half of which goes to FSP programs or full service partnerships. About 20% goes to prevention and early intervention, and 5% goes to innovation. As Scott mentioned, that can be moved around a little bit to the community services and supports can be moved around to support workforce education and training and capital facilities. So with the new allocations on the bottom right, so there's a similar amount that's going to be going to full service partnerships, 35%, which is similar to what it is right now. The biggest change is that there's a new funding category, which is for housing interventions. So 30% is going to be earmarked for housing interventions. And this is intended for children's and families, youth, adults, and older adults who have serious mental illness or substance use and are experiencing homelessness or at risk of homelessness. 50% of this would be going to people who are chronically homeless. And then up to 25% can go towards developing housing units. So that's really the biggest change. And because of that addition of the 30% for housing, it kind of crunches the remaining funding sources. So the remaining kind of community services and supports, prevention and early intervention, innovation, into this behavioral health services and supports category. So half of this would also need to go to early intervention for early signs of mental illness and substance use. And then half of that needs to go to children and youth. Counties can move up to 7% from one category to another, so potentially up to 14% to a different category to kind of adjust to local needs. Then on the next slide, so this is kind of an overview of the timeline. So this just passed in March 2024, so still relatively new. And the Department of Healthcare Services is going to be developing policy and guidance to support counties in kind of moving this forward in implementation. No changes actually, it doesn't actually go into effect until July 1st, 2026. The counties can start kind of doing things next year. The next slide, this is just kind of a continuation on the timeline to make it readable. It's too small if we try and fit it onto one. And then on the next slides, these are just some different resources for MHSA modernization, including the actual bill itself, a few different fact sheets, and some overviews of MHSA and Prop 1. And I believe, Scott, you have these on your website as well.
Right.
So with that, I'm going to pass it over to Scott, like if you want to talk a little bit about the local context and then open up to any questions that folks have.
You bet. And I talked about this before. If you've attended our previous meetings, you've heard all of this.
It's for.
Hang on, mute. There we go. So we're still, as anything that's new, we're still kind of discovering how this is going to shake out. As Jamie mentioned, DHCS is still coming up with policy once, now that it's law, they have to develop policy. One of the options, significant options that it appears that we have is that for counties under 200,000 people, they can, if you go back to that funding slide right there, instead of that lower right-hand corner right there, where it's 35, 35, and 30, counties under 200,000 could essentially go back to exclude the 30% for housing. We don't know exactly how that looks. Does it go back to our previous categories? That hasn't been decided. We're not even sure if we qualify. There's some criteria which have yet to be developed. DHCS is going to be working with the California Directors Association, Behavioral Health Directors Association, and the California Association of County Governments to come up with what those criteria will be, but they will, according to the law, at least be centered around what housing needs are, what our population is, and kind of, tailored hopefully toward what local needs are. And so we as a community will have to decide if we are eligible, if we want to apply for that exemption. Supposedly that exemption will be, those criteria will be made known before the end of the calendar year. And so we'll have a better idea then. So things are a little bit up in the air, particularly long-term. Short-term, we are going to continue with our current 3-year plan. This update is for the second year of our 3-year plan, and essentially we don't have to make changes until we go to until this 3-year plan ends. We can start earlier, but we're not required to make the changes until this 3-year plan is over. Any questions? Okay. Paulina?
Thank you, Scott. Yeah, if anyone has any questions, feel free to drop them in the chat. Let me get us back to where we are. And of course, if anything pops up afterwards, feel free to email Scott as well, and he'll be happy to answer those. I know this can be confusing and new budget allocations, and we want to make sure that the community is at ease. Right, I will pass it to Jamie to go over our needs assessment findings.
Great. And you can go to the next slide, please. So as Paulina talked about, one of the key components of the MHSA planning process is the community needs assessment, and talking with folks and really understanding what's working well, what the needs are, opportunities for improvement, and kind of what populations are maybe most in need. So as part of that, we did the community survey. It was open for about a month in the beginning of the year, and we had 114 participants. During the first community meeting, we had some breakout discussions, and we had 53 folks who came to that meeting. In the second community meeting, we had 51 folks, and we kind of reviewed the preliminary needs assessment findings, also moved into breakout discussions to talk more about the findings and get any additional context or any information that we missed. So that's kind of the participation of what's going into the needs assessment. On the right, we're showing the stakeholder affiliation. So it was pretty evenly split with about a third behavioral health service providers, including service providers from Lake County Behavioral Health Services, as well as other community behavioral health service providers. About a third, 32%, were family or loved ones of consumers or consumers themselves. And about 25% were other community stakeholders. And then we had folks that didn't report, and just want to note that this added up to greater than 100% because some people kind of reported affiliation across multiple stakeholder groups. So on the next slide, so this is kind of the findings from the quantitative components of the community survey. The survey was 13 Likert scale questions where respondents were asked to rate how true various statements were regarding their experiences with MHSA services within Lake County across 3 different domains. So the services that are provided and how well they meet the community needs, access to services, and then also experience with services. And just so you know, the Likert scale of responses were kind of from very true to not at all true or don't know. So this is kind of a summary. Again, as Paulina noted, there's a far more in-depth needs assessment in the annual update, which Scott just put a link to, also in the second community meeting PowerPoint, if you want to refer back to that. So this is kind of a summary. But overall, there was a theme where there were kind of strengths and challenges in each area. So within the kind of services that are being provided, with the exception of peer support services, most respondents didn't necessarily feel like all of the services are meeting the community's needs across various service areas, including those people experiencing a crisis or getting help before they develop a serious mental illness. About half of folks felt like peer support services are meeting the needs, while a third of folks felt like that wasn't true. And we did also look, because we had kind of a split of roughly 30% being community stakeholders, 30% being providers, and 30% being consumers and family members. We looked at differences across those groups. And we saw that providers were more likely to feel that services are meeting the community's needs, whereas consumers and family members were kind of more likely to disagree with those statements. So seeing a little bit of division there. In the access to services, about 2/3 of folks felt like it was difficult to get a mental health appointment when needed. About half of folks didn't feel that mental health services were available at convenient times and locations, while about 30 to 40% did. And a little over half of participants felt like they did know where to go for mental health support, while about 40% did not. In the last group, the experience with LCBHS services. So overall, these statements were more positive, but still also a little bit split. So about 40 to 50% felt like mental health services support clients' wellness and recovery, are respectful of clients' culture, that services are welcoming, that providers work together to coordinate services, and that family members are involved in decisions about care. But still about 30% of folks, 30 to 40% felt like these statements were only a little bit true or not true. And on the next slide. So this again, so we did have the opportunity, because we had over 100 people that participated, and we kind of had evenly split categories. We were able to look at differences across provider groups. And kind of, as I mentioned, so behavioral health service providers were more likely to kind of rate statements positively across the board, across all of those different service domains, particularly around services and kind of ability to meet the community's needs. Consumers and family members were a little bit more likely to report these services negatively. And then other community stakeholders were a little bit more mixed. So they tended to report their experience with services more favorably, and kind of tended to report accessing and services provided more along the lines of consumers and family members. They were also more likely to just report they didn't know or not applicable if they didn't have those direct service experiences themselves. On the next slide. So these next few slides are based on qualitative data. So the survey had a few open-ended questions about which services are most helpful, what can be improved, the greatest unmet needs and populations in needs. The data, this qualitative data, is also coming from the stakeholder discussions that we had during the first and second community meetings, as well as there's a feedback survey that we've given, and some folks really use that as an opportunity to kind of provide feedback on services and address some of these questions. So we looked at all of those and kind of gleaned the high-level themes that were emerging across those different data sources. So in terms of strengths, one of the things that we heard was that people really appreciate that there's a wider variety of services than in previous years. And similarly, there's really been momentum within Lake County Behavioral Health Services and the community to keep expanding services, to keep developing services, to keep building out that continuum of care to better meet the community's needs. There was also a lot of talk about LCBHS staff and leadership being caring, dedicated, hardworking, being responsive to the community needs, and kind of taking some of this feedback and really doing something with it. There was a quote that says, I have even greater appreciation for excellence in leadership, completely sympathetic toward all the humans who keep this ship afloat. And then lastly, there were some mixed responses about experience with access to services. So what we heard from stakeholders are that services are most helpful when they are accessible, when they're consistent, and when they meet clients where they are. We heard a lot of appreciation for the types of programs that offer flexibility, particularly in offering in-person or virtual services or kind of services after hours. In terms of the challenges and persistent needs, we heard a lot about staff shortages and retentions, just hearing that some programs are short-staffed or underfunded, that because of potentially the short staffing or underfunding, staff might be feeling overwhelmed. This can lead to staff burnout and turnover. And then in turn, this can also impact like service delivery and the client experience. One kind of representative quote was from somebody saying, "My patients are hanging out in the wind, our volume has increased and services are limited." Similarly, there are barriers to accessing services. So particularly kind of heard about the need for more prevention and crisis services, especially before people kind of reach that crisis point. That available services can have long wait times. And I think this is something that we've heard that Lake County has really been working on and kind of improving the access program and making a lot of changes to try and remove that barrier and kind of improve the timeliness and access to those services. And then other factors that might be improving access are like the operating hours, which tend to coincide with working hours, making it difficult for people to get there. Similarly, limited transportation, and then in some cases, insurance mismatches of maybe some programs not accepting Medi-Cal or some programs not accepting private. Then also heard about unmet needs around housing. So kind of insufficient housing overall, but also safe and clean housing options, which can impact mental health. Also just a need to support more support for the transition into permanent housing, especially people who might be aging out of some of these kind of transitional programs. We heard that about young moms or moms kind of over 25 that are maybe not eligible for some of the programs anymore. And then lastly, heard also about like the need for inclusion of family and support people in care, that this is really needed to kind of help foster resiliency, and can also be helpful in these kind of transition moments. Then on the next slide, some of the Lake County populations in need, these kind of rose to the top. We heard older adults, that this is a challenging population to reach, especially if they're homebound, they have a disability, or don't have any family support, that structural issues could be minimizing services for this population. One of the quotes is, "There's needs for older adults, caregivers, and service providers are completely lacking, partly due to system structure, but also due to a disconnect with advocates and organizations serving older and disabled adults." We also heard a need for the LGBTQ+ community, just generally that there aren't enough resources available for this specific community. The unhoused population, again, not enough services are available, and sometimes the linkages to services aren't happening fast enough for this population, that when somebody is in need, they really need to get to that next place or that next kind of treatment option quickly. And then also for justice involved folks, again, kind of hearing not enough resources, but then also during this transition period from incarceration back into the community, that's really a time of extra support that's needed. A quote that we heard is that most people get jailed and released back to the public without anything. And then on the next slide, so some of the things that we heard about opportunities to address these system needs and challenges around reducing barriers to access. Again, we heard about kind of offering later appointment times after business hours or on the weekends, encouraging more providers to provide services out in the community, also considering establishing more services or program locations along bus routes so it's easier for folks to use public transportation to get there. As always, really needing to increase awareness of the services that do exist so people know what's available and that they can get there. One of the quotes that we heard is there's a need for public information and outreach so that people know who to contact for the appropriate level of care to avoid frustration and feeling that nobody will help. So there are a lot of services, but really just making sure that people know about them and know how to get to them. Also supporting staff in providing more training opportunities and also kind of more diverse leadership and management that matches the community. We heard a quote that diverse leadership is real inclusion. And then lastly, just improving collaboration and communication across providers and partners. And that concludes the overview of the needs assessment. I will pass it over to Scott to talk about some of the proposed program modifications for this next fiscal year.
Thank you. So in response to the needs assessment, we definitely want to implement some changes to respond to the community expressed needs. Behavioral health already recognized that we were having some issues with our access, and so actually we started implementing some changes right around the beginning of when the survey was done, trying to speed up access times and more ability to access, and we really kind of beefed up our access team to begin with. This isn't really an MHSA. A lot of these recommendations that we received aren't specific just to MHSA programs, but just to behavioral health as a whole. And so, I, made sure that these survey results were shared with our entire department, so we could start implementing and recognizing where we have some places where we can do better. Access was a big one, and so we have a whole beefed up access team, getting people into services much more quickly, much more efficiently and smoothly for them. Quicker access to medications, for example. Just trying to do much more to try and get people to services that are needed. We're also continually trying to focus on our cultural sensitivity for providing services. We've been fortunate to be able to have hired a much more Spanish-speaking workforce, so we can help provide to that. I mean, that's super exciting. I think as long as I've been here, I haven't seen this many of our staff that can speak Spanish as has previously. So that's really exciting. This has always been an area where we needed to improve, and I think that will greatly help us. Also expressed on the needs assessment were additional services for older adults in the justice involved population. We are increasing our full service partnerships to include older adults and the justice involved population. That will be able to provide more services for those two populations that are needed, and they'll have more, type of wraparound type of services. They go with full service partnership, have more access to other resources which can support those populations. And so we're excited about that. We're also still in the process for older adults hiring an older adult outreach worker, which has been a long time coming. We had one for a while, but then he left, and we're just now getting closer to getting that replaced. So these are the kind of things that we're looking at. At the same time, as I kind of described earlier with Proposition 1, this also is a little bit of a time of uncertainty. And as a result, we've kind of purposely decided that we didn't want to make a lot of changes to programming as a whole. Except for the ones that I mentioned. You know, there's other counties, particularly ones that are over to 200,000. They're really scrambling, trying to figure out ways to fund some of the programs, because, you know, when you take 30% and move it to housing, that's going to take away from other programs that exist. And so we also are looking at that, how we can fund some of our existing programs in different ways, in case we do have to go for that 30% funding that Proposition 1 requires. And so we're looking at one of the areas that would impact us greatly would be probably in two different areas. One is our wellness centers, and also in some of our prevention programs that we have. And so we're, like I said, actively trying to look at you know, down the road, how we can fund that kind of a, you know, a backup plan if the exemption isn't something that's going to work for us. Then we want to have a different way to be able to continue funding these important programs that we have. Like I said, it's because of this transitionary nature. We don't want to really start anything new. You know, with the idea that we might have to shut it down in a year because of Proposition 1. And so we're being somewhat conservative. Also kind of driving that is the fiscal forecast that the state has for the next couple of years or so. As probably many of you are aware, California tax revenues really are volatile. You know, that's how we can go from the state can go from a huge surplus of $100 billion to, you know, in a short period of time where they have a 70-some billion dollar deficit. A lot of that is tied into the volatility of tax revenues. MHSA is also affected by that, even though it's, you know, just the 1% of anything over $1 million. It's also volatile. It's always been that way. We've always kind of tried to have kind of our spending to be kind of pretty straight lined between the ebbs and the flows, the highs and the lows of the funding that we receive. And so that, you know, if we have a really positive year of funding, then we kind of save that. We have typically 5 years to save our funding, or you spend our funding, and then we'll have years where we have lows, and so we have to rely on some of those savings that we've had previously. We're going into what the state says is some low revenues coming up, and so it means we have to be a little bit more careful. So all these factors, you know, kind of contribute to kind of how we look at the plan going forward. So essentially not a whole lot of changes as far as the programs themselves, out of what, you know, besides what's kind of mentioned here. But we are also very much paying attention to the feedback that we receive from the community and integrating it through our programs department-wide. Okay.
Thank you, Scott. That was great context too, as we go into the program budget request. So I'll pass over to you to go over this part as well. And then we'll enter public comment.
Right. This looks familiar since we've talked about it about 5 times already in the last meeting, in this meeting. This is our big picture budget of our different pieces that we have. A lot of these are from, if you very specifically, if you look at the plan, this is like This is beyond even the 30,000 foot look. It's like more like 100,000 foot look at our budget, because it's the major categories. It's not breaking down where the funding is all coming from. Some of this funding is coming from revenue we're expecting. Some of it has come from revenue that we already have. For example, the cap facilities and tech needs, that's funding that's been building up through a number of years. That is, and will be going toward, for the most part, are paying for our electronic health record, and even more importantly is we'll be remodeling our South Shore clinic, which has also been in a really long time in the planning phase. Hence why it's been planning so long. That's why one of the reasons why that fund is built so much, because of that stall right there. Innovation, we're not planning on spending a whole lot this year. Innovations and all is one of those programs that we're concerned about. What's going to happen after this particular project exists. We're in the evaluation of the FSP improvement project. So it's because we're in that evaluation phase, it's less expensive than previous years. We're not at this time looking at a future innovation project until we have more guidance, if that's something we can even do. Community services and supports, as mentioned, half of the funding is supposed to be for our full service partnership. Prevention, early intervention goes to a lot of our youth programs that we have. Combination of both CSS, primarily CSS, but also a portion of PI also funds our wellness centers. So overall, like I said, we really weren't making a lot of changes as far as budget. Annual revenue expenditure report. A quick summation of that is one of the requirements that we have, although it might be changing for Proposition 1, but up until when Proposition 1 is implemented, we are required to do an annual revenue and expenditure report. Our annual revenue and expenditure report is posted on our website, which describes what funding has been spent and what's still remaining. Typically, we budget conservatively, and our programming is also fairly conservative as well as far as expenditures. But you can review that at your leisure at the webpage. It's also on the state. The state keeps track of them too. We have our reports going back a number of years if you want to look at previous years and how things have changed. Right.
All right. Thank you, Scott. Great. Yeah, we add this in. Having these available to folks increases transparency and community involvement. So happy we could touch on this. All right.
Just real quick,
Oh yeah.
Speaking of what you're kind of going off what you're saying right there. One of the changes that Proposition brings, which we will be, there's not an exemption for type of thing. And you mentioned briefly, Paulina, is there is a real push for more transparency and more accountability. And so there's going to be a lot more requirements for reporting that will be, that the state is asking for, and of course will be provided to the community as well. So as we get into compliance with that, be looking for some of those changes. We'll let you know. I'm sure we'll be posting them on our webpage.
Thank you for that addition. That is very true. That is a big part of Prop 1 and a big change. All right. So before we hop into public comment, we did want to throw in a next steps portion, just in case folks have to hop off for a meeting or another commitment. We just wanted to make sure that everyone has an overview of what's next for the annual update. And so next steps, RDA and LCBHS will be working together to finalize the annual update by integrating public comments. We will present, or not us, but Lake County Behavioral Health Services will be presenting the annual update to the Board of Supervisors for approval. And then we'll be submitting the annual update to the Mental Health Services Oversight and Accountability Commission, or MHSOAC, that oversight body that I spoke about earlier.
As well as Department of Healthcare Services.
Yes.
And we have a placeholder for the June 25th Board of Supervisors meeting to present this.
Perfect. Thank you. All right. So now we're going into our public comment period. And I'm going to pass it over to Jamie. For this period, folks can provide any comments they have on the annual update, what we reviewed, the budget, program modifications, anything that is important to you. Please feel free to speak up. And yeah, we'll kind of keep it open. Please use the chat or unmute yourself, whatever you feel more comfortable doing. All right, passing it over to you, Jamie.
Yeah, so as Paulina said, feel free to raise your hand or drop any comments into the chat. There was a question about what the Board of Supervisors date is, and that is June 25th. Kim, I see your hand raised. Go ahead and unmute.
I just wanted to share my appreciation with Scott and Lake County Behavioral Health for recognizing the impact that Prop 1 could have on our existing programs and our most vulnerable consumers of services. It's just, I know we've all been really worried about this, and just, taking the time to recognize that there's a lot more to this, and just seeing that we're not just going to shut programs down and act rashly or immediately. I just really appreciate it. I know that our hands are tied in a lot of ways, but just recognizing that there is a grave impact on our programs and our services, and not making those changes impulsively is really appreciated, and just wanted to recognize that. So thank you.
You bet. Yeah, it's Proposition 1, of course, we paid pretty close attention to it as is developed, and it was, put out for as a proposition. And it was alarming. It barely passed. It passed by, just a razor's edge. If you happen to examine the California map of what counties passed it, it was the coastal counties which all passed it. The rest of the state did not. And that kind of makes sense, because those are the larger population areas that have probably the bigger issues with homelessness. And so there was definitely an idea that mental health service funds could be used to address homelessness. That was the governor's intention. And so, but what the governor didn't say was, by moving funds to address housing, that's going to take away funds from something else.
Yeah, I agree. I think, we can all recognize that housing is a crucial need, not just in our community, but for the state, but to understand the impact that we have some amazing programs happening here in the county, and to see those potentially go away or even be reduced when I feel like we already, do so much with minimal resources. I just think it would be detrimental. So I know y'all are working hard, and I just want to say we hear that and we appreciate that.
You bet. You bet. Thanks, Jim. Appreciate you.
And I see a hand from Wendy. If you want to go ahead.
Hi, I just wanted to express my appreciation for the collaboration with behavioral health, with probation, and working with justice involved. And as we continue to expand that by co-locating in our new Lower Lake building, I think the services are just going to improve, and I appreciate that partnership.
Thanks, Wendy. We are super stoked about that as well. just a great partnership, and I'm really glad that we can, start using our full service partnership funding to help that population. I think that, we're going to have just that much better services for them. And so we're really gearing up for that and super excited. I got to see the building this week, and it will be great rubbing shoulders together.
Yeah, it's going to be great. I'm excited.
Hey Scott, this is Ron Montez. Can you hear me?
Yes, I can. Ron, how you doing?
I'm doing well. Yourself?
Good. It's good. Great here. I appreciate you being here.
I wanted to extend my thanks to everybody who's involved in these this critical and also very needful services that's being provided on the Lake County Behavioral Health Services. I appreciate Scott and his input and his heart to want to do more. I understand how things are with this Prop 1 because in dealing with Native American issues on a higher scale, laws are passed and they're put into motion without actually looking through the whole problems that are caused. They look to solve one thing and it causes more problems. And unfortunately, we have to live with those. One of them is our area of NAGPRA getting our things back from the museums, and they never put a clause in there to help support the tribes. And so the people who took the things don't have to pay for it to give it back. They put it on the tribes to go and find it, pick it up, and bring it home. And so we've held our voices loud to say how not thinking through the whole situation. On top of that is those articles have been treated with poisons, and there's nothing in place to handle that, and so we had to bring that up. So there's an item after item that keeps coming up, which because of not enough forethought, not enough information, not enough communication with the people who is being affected, and the laws are put into place to cover some of the in-your-face problems that's happening. And so I feel for you, and I feel for our county, and I know that this is on your hearts and on your minds because this is an area that's really important to you as services and handling those, and you hear the hard things that happen from the actual people sitting in the streets or suicide parents and other things, so I really feel for you, and I do appreciate all of your guys' help and the work that you're doing. And I encourage all of our people who is there listening, however you decide to do it, you need to hold them up in prayer or blessing or send some good thoughts their way. All of you need that because this is touching areas deep within our spirit and our soul, as well as for the Native American population in Lake County. There's still a mistrust on any services, white people, law, anything, because it has been abused in the past so much and continues. And so that is an area that stays away because of the stigma and because of the distrust. And so we've been working with Scott on the Pathfinders group at Circle of Native Minds. In my last tribal meeting, the last Saturday of last month, we had some people stand up and said, we would like for everyone here, there was about 300-400 people. We would like for everyone here to stop supporting the Circle of Native Minds. And they started to list off things that they have experienced in trying to get help. And before they could finish, I had to stop them and stand up and encourage them not to give up, because there is a remnant of a elders group that has been there since its inception, meeting still, praying and trying to find ways to help our people with the highest teen suicide and dropout rates and so on that keep happening in our cultural people. And I was able to get them to hold off from their hostility towards the Native Circle of Native Minds, and to try and find ways that we can help to support, because we know we have needs. We know there are people are hurting. And we know the traditional ways of how we deal with those. And that's foreign to government, but to us, we know how to do that. But we have to go through the different hoops, same hoops you're jumping through, to get access and finances to go and do that. Our own tribes are suffering themselves because of leadership. Anyhow, there's more to it than that, but I just wanted to just say that I appreciate all the work that you guys are doing and understand the difficulties and the heartaches. And I want you to know that I'm praying for you. And I know our elders group will continue to pray for you, and that we will still continue to be there, services or not, because the people are the important things that we have to help. And that's what we're all in the business of doing. And so I commend you all. Keep up. Don't give up. Lace up your boots and pull them up, and find ways and work with each other to get things accomplished, which I know you're doing. It's more pressure on you and stress because of finances, but you're doing a good work, a good thing. So
Thanks, Ron.
be
I
encouraged.
appreciate that. I sure appreciate you standing up for us too. I owe you one there. Sounds like it. You know, the tribal community, we are, our department, our leadership, myself, are very dedicated to recognizing that generational trauma, you know, does exist in our tribal population, and it's not just a cultural issue; it's a behavioral health issue.
Correct.
And we want to be able to address that and help our brothers and sisters, you know, be able to live full lives, proudly and honorably. And so we're doing everything that we can with our limited resources to try and assist in that.
Thank you. That's all I had. Thanks.
Okay, thanks, Ron.
Any other questions or comments from other folks? And again, if you feel more comfortable, you can drop a comment into the chat. I see Samantha.
Hi, thank you. I know we've talked about a lot about Prop 1 and Prop 1's shifting of funding. I'm more curious and concerned about the current governor's budget and all the cuts being made across the board, and how that will directly impact us, because I do know that there is some cash flow funding issues for many of us. And how will that directly impact the programs that you're currently serving for that next year?
Well, that's a great question. I appreciate that. It's a very intelligent question too, because we are impacted by some of the things that are going on in the government, but not necessarily, well, I guess kind of more indirectly with the cuts. Fortunately, MHSA, because as Paulina described it, it was a proposition, and so that means it's, you know, because the people voted for it, it's protected. The only changes that can be made to it are from another proposition, and that's what Proposition 1 did. But as remarked, you know, the amount of funding isn't going to change. But, you know, don't tell anyone else, but I'm sure that the state, you know, looked at the revenue that MHSA was making and thought, wow, we could do some good things with that. And that's where Proposition kind of originated from, I'm sure, but don't tell anyone that. That's just my opinion. But we're also indirectly dealing with, you know, some of our, as a department, funding issues overall, particularly with our Medi-Cal funding. We seem to have hit a perfect storm of change, with all different changes happening at one time. You mentioned Proposition 1 as a major change, but that's not even the biggest change that we've been facing. We've also been facing sure everyone's heard of CalAIM and the resulting payment reform that goes with that. And plus, we got a new electronic health record, which I briefly mentioned. And so, you know, you have those things, and then the state having some cash flow problems. So they haven't been able, you know, from that forwarded to us our Medi-Cal, you know, that we have, you know, from the services that we provide. The way the billing works is, it's kind of the new way that billing works is now kind of a multi-step process. Medi-Cal has always been based on, for every dollar spent, the county spends 50% of that, and then the federal government will reimburse the other 50% for the full dollar. And it used to be that we would bill the state, who in turn, you know, receives the funding from the federal government, for that 50%. Knowing that we had the 50% in-house that we receive from other tax revenue funding, such as our vehicle license funding. But the new way they do it is the state now takes that 50% local match, then literally matches it with the federal dollar to give us the whole dollar back. So they take 50 cents, then give us $1. So we're without that 50 cents until they give us that dollar. And that's the problem we're having right now, is they're not giving us that dollar. And so they're taking funding, but not giving funding yet. And so that's created some hardship for our department. Fortunately, the county has been super in supporting us with that. If you've listened to any of the Board of Supervisor meetings with our director and fiscal staff, our Board of Supervisors is lending some general fund money to us until we do finally get the state to get us that full amount that they owe us. So in the meantime, we're having to be very prudent in our spending. You know, we're not doing a lot of hiring new staff, for example. We're not even little things like our poor wellness centers. I feel bad for them, because usually we provide food for these public hearings, and we didn't do that just because we want to be careful of our spending at the moment. And so we are being very, very prudent in what we're doing. The state owes us about $11 million right now, last I heard. And so we're patiently waiting for that and working with the state and a bunch of other folks, lobbyists and so forth, to try and get that funding back to us.
Thank you. And just a follow-up question with that, in regards to the proposition, you know, I understand that that's a set amount. However, we know from past experiences that if we have funding sitting for too long in a general fund unspent for propositions, the state can ask for that back. Is there any concern regarding that for this process? Because I know you mentioned that you're waiting to be able to build for or to remodel or whatever it was. And you have that funding kind of sitting, waiting, ready to go. Is there fear that will be taken back at this point?
Another great question, Samantha. You obviously must understand a little bit about MHSA right there. MHSA does have spending timelines. Generally, we have 5 years to spend our funding. I think I mentioned that in passing earlier. And so when we receive, you know, the funding that we receive this year, we have to have all that funding spent 5 years from now. And so, as you can imagine, we're doing, you know, whatever we receive, you know, first that comes in is the first that we spend. But that does give us kind of a five-year cushion to be able to spend and be safe, that we'll have funding, you know, throughout that time period. CAF facilities and tech needs, and also WET are an exemption to that 5 years, in that they have 10 years to spend that money. And so we have even more flexibility with that funding that's there. Hopefully that answers your question.
Yes.
If I talk too technical or anything like that, please raise your hand or something like that. You know, I'm kind of used to this world, and so sometimes I might take for granted that everyone else knows what I know. So if you don't understand anything I'm saying, please let me know.
Thanks, Scott and Samantha. Any other questions or comments? Again, you can drop them into the chat, and Scott also mentioned that if you prefer to send him an email, you can do that too.
It's a big chance to comment. We do appreciate our community. We couldn't do this without you.
You can maybe give another minute if anything's percolating.
I think I wanted to add, which we haven't mentioned, with Proposition 1, is that, you know, ever since Proposition 63, which set up MHSA, everything that we've done has been community driven, you know, with planning meetings such as this. With Proposition 1, the law is changing a little bit on that, in that it's not just going to be MHSA or BHSA, it's going to be community planning for the entire department, which will be interesting. So, you know, we'll be talking in the future beyond just mental health services programs, but programs that affect, you know, that are department wide, for both mental health and substance abuse. And so that'll be exciting to, you know, have that kind of broader discussion. So it makes the, our community needs assessment all that much more pertinent. Because it'll be, addressing our entire, we already, like I said, I share it with our department so that we are aware and we definitely respond to as a whole, but, in the future, we'll be hearing, from about all of our programs.
Think if there are no more questions or comments, we might close this portion, but again, so technically I think the public comment period ends today. So if anything pops up as you're marinating on kind of what's been said, if you have any questions or comments or concerns, again, you still have an opportunity to send Scott an email at scott.abbott@lakecountyca.gov. And I
Or
think
call me. You can call me too.
you can call him too. Yeah, so I think with that, maybe we'll move on to meeting close. So again, we have a meeting feedback form. Folks at the peer support centers, you should have paper copies of this. If you have a minute, if you'd like to provide any feedback on the meeting, the link is at the bottom, or if you have a QR code. We've gotten really good feedback from this form. So, if you also have a comment that you'd rather drop in there, it's anonymous. So you can drop a comment in there. Feel free to use that form. And I think that's it. So again, after this meeting, Patty is going to upload the recording and the slides. I imagine Patty by the end of the week. And then again, if you have any questions, you can email Scott or call Scott. Patty's email is also on there. And then one of the representatives from our team, Courtney, her email address is there as well. Thank you again for your participation. Scott, any closing remarks from you?
Well, I want to give Stacy, do you have anything that you'd like to say?
I'd just like to thank everyone for joining us today. It's a lot of information and a lot of unknown happening right now, but I think that we're all working together to help our community. Also, I'd like to say we do have openings on the Behavioral Health Advisory Board. We meet at the Circle of Native Minds on the second Thursday, so next Thursday at 4 p.m. in person. Or if you're interested, I can send you the Zoom link if anyone is interested in joining. And we really need a consumer under the age of 25 to meet our guidelines. So.
Yeah, I think if I remember right, Proposition 1 also affected behavioral health boards, didn't they?
Yeah.